for our first presentation of our Veterans Series. And we look forward to today's presentation. We do have a chat feature that's active. For those of you who have used chat in the past, feel free to drop a question in chat if you'd like to start that process. For those of you who haven't used chat, you can look for the chat icon and type your question in, and we'll make sure we try to get to as many questions as possible. So with that, I'd like to introduce our guest, Nikki Addonizio. And I've been practicing saying your last name, Nikki, for the last 5 minutes. So I think I'm just about there. So Nikki, if you want to go ahead and unmute yourself, if you can, and go ahead and just let everyone know who you are, a little bit about yourself, and you can have it from here.
Great, thank you, Daryl, and thanks for having me. I am Nikki Addonizio. My legal name is Noreen, so some of you may know me as Noreen, but I go by Nikki. And I have been working at the VA as a social worker for 17 years now. Before that, I was at the Native Hospital, and before that, I was at the Yukon-Kuskokwim Health Corporation. So I've been a social worker in Alaska for almost 26 years, and I'm very proud and honored to serve Alaska's veterans. I've been really happy with the VA for a long time. When I first came on, I worked as a discharge planner at JBER. So I did that for many years before I took on working with long-term care. So again, it's my honor to serve Alaska's veterans, and I'm really grateful to be asked to speak to all of you today. I'm going to try to share my PowerPoint. So am I a co-host, Daryl?
Yes, you are a co-host, Nikki.
All right, I'm putting the slideshow. Tell me what you guys see. Do you see my slideshow?
Not quite yet.
Oh, I'm not sure what screen you see, so hold on. Sorry, let me end the slideshow. And then, what about now? Do you guys see a slide now?
Still see you, Nikki.
Oh, uh-oh. What about now?
Still seeing you.
All right. Sorry.
I'm sure we'll get there shortly.
All right, hold on 1 second.
So while we have a minute here while we work on this, again, if anyone in there has any questions that they want to make sure we address today, feel free to drop those into chat.
I'm hitting share screen. And then let me do screen 2 and see how that works. What about now? Oh, let me hit share.
There we are. Now we can see it.
Yes, really? Okay.
Yep.
Now I'm going to go to slide, show. Excellent. Okay, so everybody can see it now?
I can see it, Nikki.
Excellent. So the way the VA is split up is kind of interesting. We have the Veterans Health Administration, the Veterans Benefits Administration, and the National Cemetery Administration. The way I've described it in the past, some of you who've heard me talk have probably heard me use this analogy, but it's like 3 helium balloons. You've got a pink balloon is the Veterans Health Administration, a blue balloon is VBA, and a yellow balloon is the Cemetery Administration. Kind of all separate helium in the same balloon bouquet. So I am speaking to you today from the Veterans Health Administration, which has a different component, but obviously the focus is on healthcare. So that's how the VA is split up. Now let's see if I can, okay. So these are another analogy of the administrations and who runs them. and I'm going to talk a little bit about long-term care within the Alaska VA healthcare system. So there's a lot of different programs that are designed for veterans to remain at home in their community. And that's what I'm going to be talking about today. I'll be talking about community adult day health care, homemaker home health aid, outpatient respite, and veteran directed. I'm not fantastic at watching the chat and talking. So I think, unless Daryl, you have a suggestion otherwise, I'm going to go ahead and do a brief presentation. I'm going to try to keep it short so we can allow time for questions. So it may appear as though I'm going very quickly through the slides. They're mostly for me just to kind of prompt me to stay on task. But I do, go ahead and feel free to interrupt me or to save your questions for afterwards. But I am going to go through them at a clip, and I may skip a couple slides. Any questions about that?
Nikki, we can go ahead and take care of the chat so you can focus on the presentation.
Excellent, thank you. So in order to be eligible for any of the programs through the VA, through the Veterans Health Administration, a veteran must apply for VA healthcare and be assigned a provider. Now, all of you may know this, some of you may not, but for veterans healthcare, you actually have to apply for it. It's not an automatic thing that happens if somebody's a veteran. They're not automatically enrolled in VA healthcare. So they actually have to apply for it. And at our VA in Anchorage, for those of you who are in Anchorage, you can walk into the building with a mask. Right behind our information desk is an eligibility office. And you take a number and you will get to speak to an actual human who will talk you through the process of applying for VA healthcare. The application is the thing that you fill out to apply for VA healthcare is called a 1010EZ, Elephant Zebra. That's the application for VA healthcare. You can get it on the website, which is va.gov. I think it's a pretty user-friendly website, frankly. And when you show up to the VA, or if you're doing it online, which is another option, or by mail, or there's an 800 number, there's lots of options that you'll find on the va.gov website. But basically what they're going to be looking for is proof of income and your DD-214 separation paperwork that people get when they separate from the military. So I do not work in eligibility, and I'm not going to, talk for a long time about that process. But that is the first step, applying for VA healthcare. And some people don't realize you even need to apply. And some people, frankly, have decided that they don't want to utilize VA healthcare until they realize that there are some benefits that the Veterans Health Administration can offer to them that maybe they couldn't get in the private sector. So, and people are allowed to use as many insurances as they want. They can use Medicare, they can use their VA, they can use private long-term care insurance, and sort of pick and choose which insurance gives you the best benefit. So I do encourage people to apply. There are, and again, I'm not going to get into the details of eligibility. I know that you've got a real interesting series coming up. So hopefully you'll have someone with expertise on eligibility talk at some point. But there are income requirements for eligibility. So it's for people who are either low income or service connected. And service connected basically means that when you were in the military, something happened to you and you presented to the Veterans Health Administration after your service time, and you were examined and rated based on a particular injury. So someone might be 10% service connected for hearing loss, for example. And then even if they don't meet income requirements, they're still eligible for VA healthcare because they have a service connect. They may have a copay, and there's lots of different levels that, again, I don't have a high level of expertise on, but it's always worth exploring. Certainly can't hurt to just look at whether or not you might be eligible. So does anybody have questions about that before I move on to the presentation?
And Nikki, this is Daryl. Just want to let everyone know that if they'd like to, they have a couple options here. They can drop a question in the chat feature if they'd like, or you can unmute yourself and ask a question live if you prefer to go that route.
We don't have any questions in the chat, Nikki.
Excellent. So once you've applied for VA healthcare, You have a provider. That provider might be in a VA building in Anchorage, Matsu Valley, Juneau, Kenai, Fairbanks, or they may be your community provider that's been assigned to act as your VA provider through our community care department. So you're eligible, you've applied, you meet income requirements or Service Connect requirements, you've asked to have a provider assigned. Once all those things are in place, you can now consider utilizing VA long-term care services. So in order to be eligible for the first program I'm going to talk about, Homemaker Home Health Aid, you need to be in a position where you need help with care of your body, bathing, dressing, transferring, toileting, or if you have a cognitive impairment, maybe you're confused, maybe you have dementia or some related disorder, and you can do those tasks, but you require prompting and cueing to do them. That's the first line of eligibility for the program. So at this point, nobody has a copay for Homemaker Home Health Aid, but that may change. So I'm going to stay on Homemaker Home Health Aid before I move on to adult day services. But we have vendors. The way we work it is that we have vendors all through the state of Alaska. There are some areas where we don't have vendors, but we use agencies like Easter Seals, Homewell, Comfort Keepers, McKinley Services, Maxim, Midnight Sun, Always Caring. I could keep going on, but we do have a lot of vendors that are in relationship with the VA to provide that service to veterans. These agencies are our boots on the ground. They have been out there during the pandemic, still now as we continue with this pandemic. Often our veterans only lifeline, people going into their home. Our program has not slowed down one tiny bit at all in the last 2 years. In fact, it's probably increased. Our PCAs, personal care attendants, are going out into homes and providing service. Like everybody else, our agencies are struggling with staffing. There are some communities right now where the vendors don't have staff. We're really struggling in Fairbanks right now. We're really struggling on the peninsula. Once you get outside Kenai, Soldotna, all the way up to Homer, we have veterans where we're not able to provide service because the agencies don't have staff. So we are in constant communication with our agencies as they recruit and as they too struggle with not being able to provide service to people because it's super challenging for them as well. So there are some areas where we don't have vendors. And like in Sitka, for example, we haven't had a vendor in a really long time. And then there are lots of areas in the state where we don't have vendors, but I'm going to talk about an alternative program. So that's Homemaker Home Health Aid in a nutshell. We call it H/HHA. Some people call it HAHA. I am not one of those people that calls it HAHA, but there are people that do. But it's basically like the VA version of PCA or direct service.
Nikki, your slide says community adult day healthcare.
I know, I didn't get up to it yet. I just kept talking about Homemaker Home Health Aid.
Okay.
And I didn't know how to, oh, here, I could have moved my slide backwards. But anyway, I'm going to stop talking about Homemaker Home Health Aid and move on to the correct slide that's on your screen right now. Community adult day healthcare. We have a few adult day facilities in Alaska. In Anchorage, we use Turnagain Social Club and LifeWorks and Serendipity. And in Homer, we use the Homer Senior Center. And in the Matsu, we use LifeWorks, and that's it. That's our adult day services. So adult day services is for someone who wants some kind of a structured activity during the day. Two of them in Anchorage and the Matsu provide transportation, LifeWorks and Turnagain Social Club. And the VA will pay for up to 3 days a week in an adult day center with a referral from the doctor. So let me go back to how does one get a referral? So the way you get entry into this program is your VA provider sends a consult and it comes to my program. We process it and we authorize the service. So that's basically how it works. But I'm going to go into that in a tiny bit more detail. So that's Adult Day Healthcare in a nutshell. We talked about Homemaker Home Health Aid. So again, to refer, so we use a form called a case mix tool. The doctor fills out a consultation form, and it measures how much help the veteran needs with things like sitting up in bed, going to the bathroom, walking, toileting, showering. Based on how much help the veteran needs, that's how many hours we authorize. We have a system where the scoring tool is scored. There's a letter score, and the letter score translates to how many hours we provide. So for example, if a veteran has 4 to 6 ADL dependencies without any significant behavioral issues, like they need help with toileting, personal hygiene, showering, transfers, ambulation, they might get 11 hours a week of services. So we would authorize the vendor, say for example, it's Homewell. We would send Homewell paperwork that authorizes them to serve the veteran 11 hours a week in their home. And that's basically how we determine how many hours are authorized. It's pretty objective criteria. So that's Homemaker Home Health Aid. Sorry, my mouse isn't cooperating. So Respite is where we use the same vendors, and it's for veterans who live with someone, and that person that they live with has concerns about leaving their loved one home alone for whatever reason. If they have concerns about leaving their person home alone, they're eligible for Respite. So Respite can be used in conjunction with the Homemaker Home Health Aid program. So often veterans will have Homemaker Home Health Aid and Respite. So Respite would be for like a spouse or an adult child who lived in the home, who needs a break from their caregiving responsibilities. And, you know, even if like say, for example, we have a veteran who had a severe cardiac issue and they're struggling with their activities of daily living, but they're kind of getting through it. But perhaps the spouse is so maybe traumatized by the event that they've been concerned. They haven't been able to go to the grocery store. They haven't been able to do any self-care, go to their own appointments. So maybe they might not be ready to use Homemaker Home Health Aid, but they are wanting to use Respite, and they would be eligible. So, you know, really it's based on the comfort level of the person that lives in the home with the veteran. So the rule is that the person has to live with the veteran to be eligible for Respite. And the same, the case mix that we assign, say it's a D and say it's 11 hours, they would get 11 hours of Respite a week. And that's how Respite works.
Nikki, can we
Again,
pause just
a
moment?
referral from the doctor. Go ahead.
Hi, Nikki, can we pause here for just a moment? Just want to give everyone an opportunity to see if there's any questions.
Of course.
That they may have. Thank you so much for that. Just want to let everyone know, if you do have a question, feel free to drop that question in chat, or you can unmute your line and ask that question live. So I want to go ahead and just give everyone a few seconds to see if we have any questions coming in, either chat or the live feature.
So Nikki, I saw that Respite is up to 6 hours per day though, correct?
Well, we don't really dictate what the schedule looks like with the, you know, that's worked out between the vendor and the veteran and their family. But certainly the agencies have their own policies regarding overtime and how many hours the employee can work. We generally don't dictate what that looks like.
Okay.
But yeah, I mean, typically it's not even in a 6. We used to be forced to do 6-hour blocks. I don't know if you remember that, Teresa, but we're not anymore, which I'm very grateful for. The more flexibility and the more choices that the veterans and their family have and how they want to use their benefits, the better in my mind. So really they get to decide what that looks like schedule wise.
Thanks. I don't see any other questions.
Excellent. I'm going to move on to another program that we have called Veteran Self-Directed Care. And so the way I'm going to describe it in a very rudimentary fashion because it can be super complicated. It even gives me a headache. So I'm going to keep it simple. So the way the Veteran Self-Directed Care Program works is that the VA is in partnership with the Aging and Disability Resource Center, some of the facilities around the state. So right now we're in partnership with the Independent Living Center, which is in Kenai and Homer area, also goes out to Kodiak, Valdez. So that's the Independent Living Center. They're one of our partners. SAIL, Southeast Alaska Independent Living, all through Southeast Alaska, and Matsu Links. Those are our partners with the Veteran Self-Directed Care Program. And so it's similar in setup to Homemaker, Home Health Aid and Respite, in that we get a referral from the veterans, either VA provider or community VA provider, same case mix, same tool, same scoring, except instead of a case mix D authorizing 11 hours, the case mix D, we would go into a national budget and look. So say, for example, we get a referral from Search in Sitka for a veteran that wants to be on veteran self-directed care, and the score came out as a D. Instead of them getting 11 hours, they would get a budget that's associated with a D in Southeast Alaska, which I don't have my calculator, my budget calculator pulled up, but it's about $2,200 a month. So the veteran would be authorized, the veteran or their designee would use that $2,400 a month to hire their own employees to provide care to them in their home. So we pay, with our Sitka example, we pay SAIL a monthly fee to help the veterans navigate all the intricacies of the program. How it works, helps them come up with a spending plan, helps them to recruit staff, helps them figure out workers' comp, taxes. The veteran essentially becomes the employer. There is no agency. The veteran is the agency. They are their own employer. They hire their own employees. And the goal of the Veteran Self-Directed Care Program, it is for veterans that are a case mix D or higher, is real specifically to keep veterans out of nursing homes and assisted livings and in their own home, directing their own care in a way that they determine is best for their own quality of life. So they may hire family members, they may hire neighbors, they may fly up a nephew from Tennessee who's not working, who wants to be employed by them and care for their relative or loved one. Really they get to decide. Of course, we do recommend strongly that they do background checks on everyone that they hire, but it is their decision and they direct their entire budget. With the help from, in the Sitka example, it would be SAIL. If they were in Homer, it would be ILC. If they were in the Matsu Valley, it would be Matsu Links. We use a payroll company in Vermont called Eris, who releases payroll. So the veteran, if they're their own employer, would sign all the time cards of their staff, send the time cards to Eris in Vermont, and Eris sends paychecks and helps them, navigate everything tax-wise and workers' comp. So it's a really successful program. We're doing fantastic with it in Alaska. We have almost 90 veterans on the program. The budget can go significantly high depending on the level of dependency that the veteran has. The highest case mix we have that we have to get national approval for is a case mix V for ventilator. So for a case mix V, we need to get approval, all the way up to DC. And we did have a veteran not too long ago in Homer who was a case mix V with ALS, who lived with ALS for 2.5 years, utilizing that Veteran Self-Directed Care Program with a staff of about 10 people or 11 people, round the clock, run by his tiny, amazing spouse, who basically could be a nursing home administrator after this, I think, because she did such a beautiful job. And he was able to pass in his home with ALS on a ventilator, looking over Ketchimek Bay in his living room, being surrounded by people he loved and directing his own end of life care. So he did recently pass away a couple months ago, but he was our only case mix V But we have veterans with special nursing needs who are, high case mix like K. And they, again, are directing their own care, basically like nursing home level of care in their own home. So that is veteran self-directed care in a
Vicki?
nutshell. It's a national program. Go ahead.
A couple questions. One question is veterans directed home care available throughout the whole state or just in those communities?
Just in those communities. So basically, it's everywhere except Anchorage and Fairbanks.
Okay.
I
And then we
mean,
have,
and we don't decide who our partners are going to be. The way it works is that the Aging and Disability Resource Center has to approach the VA for the partnership, and then they go through a readiness process that can take up to 2 years for policies, manuals. They have to have staffing. So the ADRCs have to have the infrastructure to enter into this relationship with the VA. So the ADRC agencies that we have relationships with are the ones that have chosen to have this relationship with us and have had the ability to at this point.
we also have another question. Does the doctor do the assessment for the activities of daily living needs before referring to your agency?
Yes.
Okay. And then if people in Anchorage or Fairbanks wanted to connect with their ADRC and try to encourage them to apply, can they do that?
Of course. And I know Anchorage and Fairbanks are interested. I've talked to staff in both ADRCs. Of course, we use the ADRCs like everybody does for every one-stop shop need for our veterans. Care coordination, help with resources. So we still do have relationships with Anchorage and Fairbanks ADRC, but I believe they just haven't had the staffing and the support that they need to enter into the relationship. I do not think it's from lack of interest. I know for sure that both of those ADRCs are interested. I just don't think they've had and I hate to speak for them, but I believe they've not had the infrastructure, and they've been fairly overwhelmed with other tasks. So haven't had the ability to move forward with that relationship with the VA. But if there's anyone here, and I think there probably is, from the ADRC, I'll stop talking for a second and let you guys chime in.
I don't see anyone.
Okay.
So go ahead and move on.
Okay. Yeah. So it's a good program. We've been really proud of it. And I'm looking at the time. I personally have been, in fairly overwhelmed mode, kind of running all the non-institutional care programs. And recently I got another social worker assigned to me at the VA, which I feel really blessed about, Corey. And I know that Corey's on this call, and I'm just so grateful to have her here, and feel like I'll be able to pay a lot more attention to the veteran self-directed care program and growing that program as well, now that I have more staff. So anyway. So this is a little bit more information about veteran self-directed care. Again, your first line is your primary care provider. If you're interested in any of these programs, if it kind of sounded like a blur, but you knew it sort of sounded cool and you think you might be eligible or your loved one may be eligible, talk to your VA provider and ask for a consult. They send it to us by fax. If they're in the community and if they work within the VA system, we get it through the medical record system, CPRS. We get referrals lots of ways. If the referral comes in an incorrect or non-traditional way, whatever, pigeon. We don't want to make it difficult for people to access these services. We will reach out to the provider and talk them through how to make the referral to us in the correct way. So, there really is nothing incorrect. So I'll touch briefly on the community nursing home program. I know the purpose of the talk today is about non-institutional care, but we do have a nursing home benefit for some veterans who are 70% service connected or higher. There's a little flexibility around that. I'm not going to get into great detail, but we do have community nursing home program for veterans who are highly service connected. In Anchorage, we have 2 nursing homes, Prestige and Providence Extended Care. Going north, the next community nursing home we have is Denali Center in Fairbanks. Going south of Anchorage, the next one is Seward. After that, Homer. I think we have 9 community nursing homes right now. So the veteran would need to meet skilled nursing level of care and be 70% or higher service connected. We also have an end of life benefit for any veteran, regardless of their service connection. If they have a prognosis of 2 months or less, the discharge planners or their doctor can send paperwork to us supporting that prognosis, and we can approve end of life care in a nursing home for 2 months, if need be, if that's something that the veteran and their family want to pursue. So I see somebody asked a question about the Pioneer Home in Palmer. So the Pioneer Home in Palmer, I know that there's going to be a whole presentation on that I saw in your series this morning. But yes, we do. That is our veterans, our state veterans home. And they are not a nursing home. They are licensed as assisted living, and the VA does not pay for assisted living. In the Palmer Pioneer Home, they do have a 10-bed nursing home unit, fairly new. It's about 3 years old. It's recognized as a nursing home by the VA, by the federal government. So if a veteran is highly service connected and they want to live in the Homestead neighborhood at the Palmer Pioneer Home, they would get a full benefit for that. Otherwise, we do have per diem at the Palmer Pioneer Home. So for a veteran who's independent, can propel themselves to the dining room, can help themselves with personal hygiene and personal care of their body, they could potentially be eligible for $49.91 a day per diem towards the cost of their care, if they're not requiring assisted living home level of care. But that's a whole other discussion that I'm curious to know who's talking from the Palmer Pioneer Home.
So we're Nikki, we're going to have Josh and whoever. Josh is the administrator of the nursing home. So
Josh knows everything.
Whoever he brings with him. So we do have another question in the chat. Do you have a rough idea of what the income requirements might be for these VA benefits?
I think it's similar to Medicaid, but, and again, I'm not an expert, but I think the VA takes into consideration your medical expenses, where I don't believe that Medicaid does. I know there are people here that are way more experts on that than me, but I think that's one of the benefits of the VA and how they look at your income as a whole.
So Nikki, just to clarify, is it income requirements or service disability?
Correct, Teresa.
Okay. And remind me again what the service disability.
So it means that something happened to you when you were in active duty. Perhaps you were exposed to loud noises and now have hearing loss. So when you got out of the military, you went to the VA and you said, I have hearing loss. It's as a result of my being in the military. So they had you evaluated by an audiologist or whatever specialist was deemed appropriate. And you were rated, say, for example, 10% service connected for hearing loss. Now, regardless of your income, you're eligible for VA healthcare. You may have a copay, but you are eligible for VA healthcare and can avail yourself of any of these programs.
Okay, I just wanted to clarify because I think that wasn't super clear. So here's a scenario that when I was working for the long-term care ombudsman happened quite often. 2 folks are living in their home. Let's say the gentleman has a stroke, ends up in the hospital, and the hospital won't discharge to home without services. How does somebody start this process if they have veteran benefits, but they haven't started with the veteran health care?
They could call the VA and ask to be assigned a provider, or have their discharge planner or family member help them do that.
Okay, so someone at the hospital could help them potentially.
Yeah, it happens all the time. we get referrals constantly from discharge planners for veterans who really have never availed themselves of VA services. And suddenly they need like personal care, which really there's hardly any other insurance that pays for that. I mean, if you have specific long-term care insurance, it'll pay for personal care. If you have Medicaid, it'll pay for personal care. But I can't really think of any other insurance that pays for it other than VA. I mean,
Right.
even
So
the
just to
Native
clarify,
Medical Center doesn't pay for it. I mean, so we're pretty rare in that we cover non-medical personal care services. So people do decide at like age 90, hey, I want to use my veterans healthcare benefits because, you know, personal care is like $35 an hour. So it's worth pursuing, you know, whether or not they're eligible for VA healthcare to get that benefit.
and I think a lot of people think that Medicare, so the retirement that you get from Social Security, pays for home health care, but it does not.
Well, it pays for skilled home health care, but not non-medical. And, you know, the term non-skilled is used quite a bit. I have a hard time with that term, even though it kind of explains skilled versus non-skilled. But like I said earlier, like the relationship we have with the vendors who are so amazing, I hate to call them non-skilled because some of them are just highly, highly skilled. But I do use the term non-medical or custodial care. So that, you're right, Teresa, is not covered by Medicare. And people are surprised when they discover that. That is a true story.
So we have another question in the chat. Is there any coordination between Medicare and VA health benefits, or is it one or the other? Or I think I heard you say you could do both.
You can use both. I mean, I don't, like, again, I'm not the expert on that, but lots of people have Medicare and veterans health benefits, and they decide which benefit makes the most sense for them at which given moment. I know that often there's a insurance that's the first payer of choice, but I'm not really sure how that works.
Nikki, this is Daryl. Just to let everyone know that as part of this series on October 14th, we will be having a discussion on veterans benefits, and the focus will be Medicare, TRICARE, and IHS. So
I think I might be calling into that, Daryl.
Okay, excellent. Well, thank you for sort of teasing that conversation.
Yeah,
but we will be
absolutely.
having that on the 14th.
I think they all look good. Thank you for doing this. I appreciate AARP doing this.
Absolutely.
I don't know if there's anything that's going to trigger me in the slides, but again, this is me, Nikki Adonisio. If anybody wants to write down my direct line, feel free to do so. It is on your screen right now. Meadow, my colleague, she does primarily the community nursing home program. So if the discharge planners are sending a packet, for example, asking for an end of life benefit for a veteran, she's the one that would evaluate that and pitch it to our chief of staff for approval. And then this is an old slide, but Eileen Heaston is the chief of this program. And Erin Picotto is my colleague. She works part-time with long-term care. And Corey Dreher is the new social worker that I was not bragging about, but telling you guys all about a little bit earlier. So that
Nikki,
is us.
Nikki, do you have contact information for those people that you just identified?
Yep. Yeah, I can send that to you.
Great.
I don't have a slide with it though.
So Nikki, I have a question
Oh,
for
look,
you.
I do. I have everybody except Corey is on your screen right now.
Great. And for folks who aren't following the chat, Daryl will be sending out an email to everyone who registered for this event with Nikki's slides and information about the upcoming series. So if you're interested in that information, look for that email. Nikki, I had a question because we've worked together for quite a long time. We had some clients who actually got medical professionals to come check in on them. Is that not part of what you're doing now, or is that a different program?
It is another program that I work very closely with. And thank you for bringing that up, Teresa. It's home-based primary care. So home-based primary care is a fantastic benefit within the Veterans Health Administration where it is for obviously home-based homebound veterans, where the whole team visits you in your home, the physician, the nurse, physical therapy, nutrition, pharmacy, social work. So the way to get home-based primary care is to ask your current VA provider for a referral to home-based primary care. If you're new to the VA and don't have a current provider, you can call Eileen's number here on the screen. She's the chief, and she can put you on a waiting list, unfortunately, because it is a fantastic program that generally does have a waiting list. That is available in Anchorage and the Mat-Su Valley. That's it.
Great, thank you. So someone has asked, and this is not for you, Nikki, but someone has asked about the recording. So we will be recording all of the five webinars in the series. We will also be posting them or doing a Facebook Live. So you can go to our Facebook page and you will be able to see the recordings on the Facebook page. Do we have any other questions for Nikki?
People are welcome to either use the chat feature, or you're welcome to unmute yourself and ask your question live if you'd like. Well, Nikki, while we're having a pause here, I would just like to remind everyone about the dates for the remainder of this series, with focus on benefits for veterans. And on August 18th, next week, we'll be talking about what VSOs can do for you. So that's August 18th. And then we're going to jump forward into October, when we have the discussion on Medicare, TRICARE, and the IHS. Following that, then let me just get the date on that. That's October 14th for that discussion on Medicare, TRICARE, and IHS. October 14th. And October 28th, the program of comprehensive assistance for family caregivers. And then wrapping up the 5-part series on November 9th with the Alaska Veterans Pioneers Home. So again, those are the remaining presentations on the 5-part series. Teresa, do we have anything else in chat?
Sorry, I'm answering a thing in a question in chat, which is, what is the Facebook page name? So if you just search for AARP Alaska or AK, AARP AK or AARP Alaska, you'll be able to find our Facebook page.
And if you're interested in learning more about the upcoming events in this series, or would like to register for those, feel free to visit aarp.org/AK. You can find a link to upcoming events. You click on the link of interest to you and register there for those events.
Well, I appreciate you guys having me come talk, and I appreciate everybody who called in. I can't really see because I don't know how to look at a ton of things on my screen at the same time, but you know, these are not really fun things to think about. You know, nobody really wants to think about a time in our lives where, you know, we're not independent and we can't, you know, take a shower without feeling vulnerable or frightened, or, you know, we can't manage our toileting hygiene. But, you know, we're all going to get there to some extent. And I think that the primary goal for us at the VA and working in long-term care is that our veterans have the opportunity to be able to direct their care as much as possible, and have dignity and have care in their home, and maybe think about it kind of before it's a crisis. Like, what do I want my care to look like? What's important to me? What benefits do I have? A lot of people, like the people calling in today, you know, do kind of think about that in the long run. But I understand that, you know, a lot of people do wait until there's a crisis, because these are really not super fun things to think about. But again, for all of you that called in, I appreciate it. And I'm certainly available for additional questions. And like I said, I'm very honored to serve Alaska's veterans. And thank you guys for having me today.
And Nikki, thank you so much for taking the time out of your day to spend some time with us today and share your expertise, your knowledge. And I did also want to let people know, because you brought this up earlier, talking about ADRCs and what ADRCs can do for you in a number of communities. And we also have a series on that as well. So if you're listening from around the state and you'd like to know what an ADRC can do for you, again, feel free to check out our website at aarp.org/AK. You can see upcoming events on learning more about ADRCs. So again, Nikki, thank you so much. So great to have resources such as yourself available in the community. Thanks for sharing your contact information, so anyone who's on the call today can reach out to you and connect with you. Great to have you with us today. And do you have any final comments?
I don't. Thank you, everybody.
All right,
Stay
well-
dry. It's pouring. I hear the
It is.
rain just pouring behind me. Wow.
It is definitely that time of
Yeah.
August, it seems like. So anyway, well, Nikki, thank you so much. Really appreciate you being with us today. Again, we look forward to seeing all of you who have joined us today at the future series presentations on veterans benefits. So with that, thanks everyone for being with us today. Have a wonderful day, and we look forward to seeing you in the near future. Everybody, take care and have a great day.
All right. Bye-bye.